A hearty good afternoon and welcome to the session. Know more about challenges faced by couples during IVF treatment. We are glad to have Dr. Vijayageetha among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. A very good afternoon, everyone. And firstly, New Year wishes. So, Happy New Year 2023, a new beginning. So, when there is a beginning, there's a lot of plans that happens, right? And the most first idea that would come mostly among married couples is let's plan for pregnancy this year. And it happens every year, but it wouldn't have been successful. So the session is specifically for those. What are some of the challenges that is faced by the couples during an IVF treatment is all about today's topic. It is challenges that not only we will be looking into the physiological aspect, treatment based, your emotions also, and also it includes your psychological status also. So here in today's session, that's what we are going to look in depth and in detail. So the takeaway for the session would be that would be built-in awareness for anybody who is planning will know, okay, these are the points that needs to be considered. These are the points that is to be expected. These are the things that would come up. So to be well prepared so that your journey in 2023 towards pregnancy would be successful. We all start with challenges, but it is more related with an infertility treatment. So I would be going back to the basics. Let's start from the beginning what an infertility is all about. So according to World Health Organization, it's an inability for not becoming pregnant despite of 1 year or longer of unprotected sex, right? However, the cause for this inability is very difficult to determine. Initially, when a couple is like frustrated, like planning over a year and nothing happens, we sometimes tend to look into within and say, like, what's wrong with the other, right? We don't initially consider the self. We'll always look at the others and the outside environment. Yeah, we had a stressful life, we had a hectic day, there was no much time to relax. Then because of that there could have been hormonal fluctuation, my partners was already disturbed, and blah blah blah, it goes on, right? Though physiologically symptoms play the vital role, usually people do not consider that they would always look into the external and the environmental factors first. So some of the causes that can come up for not being able to pregnant is what is commonly said is, okay, are your periods regular? So they'll try to rule out from the female. Okay, if it is regular periods, are you shedding? Now your bleeding is for 3 to 5 days. To sometimes there is also a myth that says that, is it painful periods? Oh, then your uterus is working nicely. Failing to ask or also reflect back to the pointer, how healthy is your partner, and how important was your intimacy life? Was it on regular basis? Was there any discomfort? Was there any inability? And to get into more further details, to ask your partner, how was your experience? Was it stressful? Did you enjoy the process? Or if at all, to look into, if you're probing into the shedding aspect of a female, then we have to probe into the ejaculatory aspect of the male. So there are too many things that comes up physiologically. Wow, then now the plate is becoming full of questions to ponder and look into the challenges part. Why is it like challenges? Let's say you're planning during your pregnancy, and this month the periods skipped, and when it skipped, the expectation is always, oh, let me do an UPT and check. UPT doesn't show, and then you go through Google. You say, sometimes blood test is feasible. So you do a blood test, and a blood test also says negative, and then you go through your bleeding or your shedding phase. You don't shed properly, and then there's somebody in your family member, see, you have a problem. Would you mind looking into it, or do you go to a defensive mode? No, no, no. Every month it happens correctly, because I was stressed, because I did not eat properly. For the past 1 month, I was, in a very hectic job, and I had failed to do so. Probably it has impacted you cook up your stories, right? So the challenges itself is here to even listen. Forget about accepting it. First, listening to what is being pointed out through your body is the first. Second is what your environment, or through your community, or to your family members, to your friends, or your own body the symptoms is so hard that you just cannot get out of it. It distracts your work, your peace of mind, to indicate, hey, you need to look into this physiological aspect. That is why the session is all about challenges. So infertility is a concern, it's an inability, and the symptom is not known, and that but there are a lot of additional symptoms. Who do we look? That's the first question that comes to the mind, right? We look with both of you. So this is what is a holistic way of looking into a couple in case of planning for a baby. So when we look at the couples, what is the first expectation? You need to be present for consultation as a couple. You need to get validation as a couple. You would be subjected to various procedures and treatments, or investigations. Please visit as a couple. No, the blood test was for her, the analysis test was for him. I have duty that day, I can take off, I think my partner can do it. Kindly avoid this running away situation. You are failing to see, experience what your partner is going through, because for everyone it is not immediately within one's nature to accept, I have to do this. There is a tug of war, right? So both the partners would be having those. If that is the case, it is profitably seen that when couple come throughout the journey, starting from a consultation, through their investigations, through their analysis, through their checkups, one person sees how the other person is being subjected, what are the pros and cons that she's undergoing, whether you like it, dislike it, accept it, rule it, mandatory, non-mandatory, how the journey is going to be. So what would be the responsibilities that you would take on, will all come to the picture. So this makes the process stress free. Stress kills almost half of your hormones and imbalances the rest of the hormones. If that is going to be the situation, then start playing a responsible couples game. Looking into the aspects of what would be some of the infertility causes that we have seen. Initially, we would look into male infertility and female infertility. However, the main procedure wise, if you see, infertility is identified to be a primary infertility, where the couple is just not able to get pregnant for at least over a year, having unprotected sex, and not using any birth control methods. Secondary infertility, however, refers to couples who have been able to get pregnant, but they're just not able to continue with the pregnancy. Right? So, this is what you need to know. Now, the first point will come, since there's acceptance and there's many things coming up. Even before, let's say, your mother or your friend or your in laws or even your husband is going to point out, there's something that you need to look within. Try to look you within yourself. Am I obvious enough, evident enough to say that I am fertile and I can take up a pregnancy? So, the first very good solution is, if you're planning for marriage, ideally we see couples who come to visit doctors to say, I'm planning for a marriage and I would like to, physically rule out if there is any fertility issues, or if not, what are the points that I am supposed to take, because after my marriage, I'm going to plan for my family. So this is one profitable way where you would be diagnosed, consulted, investigated, assessed by a consultant and a specialist. Two, if you already know, like from a lady's side, there's a history of irregular periods, history of painful periods, history of PCOS or PCOD already being identified, you can have those pointers, and then probably after your marriage, you can get back to a specialist to say, married, but we're just newly married. So we would like to have our time and then plan for a family. How to go about with this plan? What is the timeline that is allowed for us? Can I take a 3-year break? No, I'm halfway of my professional journey. Can I take a year break? I'm just married this year. We will try to establish a good foundation for the family, and probably take the steps and responsibility the coming year. Is the physiological conditions allowing so the specialist here would assess you with the basis of your physical, your hormonal and other medical records to say, hey, according to you, your timeline is very less because your hormones are in such a condition. So is there chances that if you can postpone your other dreams, or just to say, I'm just married, I want to relax for some time and then probably plan up for my pregnancy? Is that a case? Then you would be looking to pre-planning. For working females, then it has to be a parallel planning. So your planning is already in evidence, which means a lot of points would come to the awareness, for which you have to say, I have to do this, do this, do this, do this. Then the first indicator gets avoided. Even before anybody picking on you, your body indicates there's certain things that needs to be done. So now to reduce the creeping up, or going towards infertility during your family establishment time, what are some of the points that you can focus, monitor, and can be a challenge to move forward? Would be maintaining a normal body weight. Your weight gain or weight loss always indicates that there can be a hormonal fluctuation. Exercising regularly, neither too harsh, too hard exercises, nor too sedentary lifestyle. So there should be a middle line here where you exercise to regularize your not only your hormonal fluctuations but also your physiological aspects. Strictly no smoking and no drinking. And whenever you are ready to have a children, don't delay, and always stay informed. Let's say in your history suddenly there is a skip of your periods. What do? Do not hesitate to get back to your specialist to say, this one small episode happened in between my planning. So this way you can have a peaceful planning and a healthy journey. I did say that there can be stress, right? But what are the types of stress that could interfere such a, the line that said, inability to get pregnant? Specifically with women, we've seen research data where anxiety, depression are more likely to be experienced among women who are planning for pregnancy. But if you look into it qualitatively, according to them, the planning has never been well documented. The planning is irregular. They sometimes do not follow their planning. They do 4 things and they lose 6 things. The vital things are never done on time, and so on. So what happens here? Frustration builds up. There is a self-assessment or conclusion stating that I have planned properly, and meeting the doctors, keeping the doctors informed, which is the primary aspect, all goes for a missing. So this alone leads to a lot of anxiety stating, I did everything, but why is it not happening? So this leads to a lot of stress, specifically in achieving a pregnancy. Now, to look if you're planning properly, then what is a shortcut thing that, ma'am, let me see that I would be planning it in a couple of years. What is it supposed to be done for the 2 years? Good question. So your doctor will go through your case records to say, according to you, Probably you can do weight management, you can have a healthy diet, and you can have a relaxed and a good exercises, and you focus on your career and probably get back, not failing to follow your basic quality of life impact. So this is what we see from the male and the female aspect, because even male have office targets, have other things to achieve in life. They can be halfway of a project, or a full, or in a full swing with an existing project, or planning to take up a future project. So even they need time to ponder, think, and to move on with the life's next expectancy. What would be now, once you identify that these are all your environmental, outside your control zone, some of the factors or causes that it is not happening to be happening, what happens to between you? Let's look into what are then the physiological causes once they are identified. So this would be specifically for among, let's say, women who say, like, even before marriage itself, I had history of irregular periods. I was diagnosed with PCOS. I do have thyroid. What more? So, some of the factors that could lead women to an infertility is primarily is age. Why age? The quality and the quantity of a woman's eggs begin to decline with age, which is lot of documents would speak about that. Smoking and drinking, besides not only damages your blood circulation and increasing the chances of miscarriages, the smoking also impacts on your cervix and also on the fallopian tubes. This is one of the research documents that has been evidently shown. With your the way of lifestyle, let's say irregular eating, improper diet, eating according to your whims and emotion, your weight can be a problem. Being overweight or an underweight is not going to achieve much by your fertility aspect, but it is always affects a person's ovulation. So have you noticed that in days when you're super stressed, working, not eaten properly, one activity affects the flow of the other activity, due to which the ovulation, sometimes absence of periods does occur. Post marriage, something that you need to focus into is your sexual history. How many times, how of your intimacy records are holded good, what was your partner's experience, if not today then tomorrow, and you should well maintain a sexual history. Alcohol, though there is good evidence to say that alcohol consumption needs to be avoided, a little will not do harm, is also an equal things that we've seen. However, it is better that you completely avoid alcohol. Infertility is commonly initially starts with an ovulation problem among women, because every month the release of an egg is what is expected out of an ovary. Some problems that would associate it, that would be absence of periods, or painful periods, or skipping of your periods, or PCOD or PCOS, which is a common condition that we see among here. Along with this, for women, what are the factors that we see? There can be fibroids in the uterus. There can be a condition called endometriosis or adenomyosis, and thyroid. So these are also additional attributes to cause infertility as age prolongs. So these are some of the factors that we see in females. Along with that, what are the physical factors? We also see if women who's being treated for cancer, they're subjected for chemotherapy, then the decision on the fertility preservation aspect that needs to be seen, the presence of cysts and also tumors apart from fibroids, are there problem with the fallopian tube, and the list is going ahead. So we will look into in detail with the doctors, and then they would advise that, sorry dear, there's not much time for you to take a relaxation after your marriage. Is ideally we will control the situation, and then you can plan for your pregnancy. Along with that, if there is any untreated chlamydia or gonorrhea infections, absence of periods or not at all ovulating, blockage in your fallopian tube, poor egg quality, which is very difficult to determine. But on a history of regularly, following up with scans, if you're not ovulating properly, it leads to a poor egg quality. And sometimes the shape of your uterus, or if there is an inability or an organal disorder in your uterus, then the fertilization can be impacted. So there are some of these causes that makes the female infertility aspect to become more evident. Or your goal to become pregnant is like a little bit challenging. How do you identify? Let's say you have a history of thyroid, and then there is a history of ovulatory problems or periods problem. It's high time that you start looking to it, and also add good quality efforts in your life, like exercising, eating habits, and so forth. So without much delay, we will now look into the male aspect also. Oh yeah, male also do have their problems. They also need space, listening ears, and a open mind to understand what they are also being experienced with. So first condition that we would see from a male perspective would be varicocele. There can be an infection, there can be ejaculation issues, there can be antibodies affecting their own sperm, the presence of tumors, the history of an undistended testicles. There can be hormonal imbalances. There can be defect in the tubules that transport the sperm to outside the body. So quite a handful of concerns that comes here. However, currently the most common vocalized condition is an erectile dysfunction, which we are happy to see men vocalizing it to say yes, there has been an issue. We've not been able to have an intimate interaction over a period of time. It does get disturbed. So what needs to be done is something that is now more commonly opened up. So despite of all this to be a physiological aspect, something that most commonly identified is we always assess the male fertility aspect through a semen analysis. So if the semen analysis say that the quality of the sperm is poor, or the count of the sperm is less or low, then we can suspect there can be blockages in your tube or in the reproductive system. And some of the treatment would be like improving the quality, improving the numbers on the sperm, and so forth. So sometimes the test can go to an extent of testing for genetic disorders, whether if it is present or not. So to that extent, we have indicators or investigations to probe in to see the cause. Apart from the genetic problems, health issues, issues like diabetes, infections like chlamydia, gonorrhea, mumps, HIV, in problems like enlarged veins in your test, which is what I told, varicocele. They are all other reasons why the quality of the sperm can be gone all wrong. So they also have an association over an age. So with varicocele, you cannot procrastinate to postpone, because they do on a long-term basis impact the quality of the sperm. Infections also affect the quality of the sperm. Any inflammatory conditions like mumps that you would have had during your teenagers has an impact on the reproductive aspect. Hormones like pituitary gland problems or irregularities can have an aspect. Immunological problems, there are antibodies that affect their own sperm, can be an aspect. Genetic diseases or cystic fibrosis or erectile dysfunction or a premature ejaculation can still be some of the reasons why, or can be some of the causes among men. So if you see, causes in both the plates are many. If there is no acceptance, or if there's going to be a tug of war where your emotions override, and you're not able to mentally agree that your body is in this condition, then they all will become challenges to you to even move forward, to even address a situation or a condition would be difficulty, or the couple would face difficulty if the acceptance is not there. So initially, the causes identification becomes the most important. Okay. Now, I did say about the psychological state of the person. So let's say that somebody says, "Hey, you are diagnosed with a PCO," and then the lady is like, "What? No." Uh, she starts thinking. Then there is a mental battle that starts running, and then there's a lot of thinking comes over, and then the curiosity builds in. I am not talking to you because you know too much about me. I will go talk with some other doctor, or you find some person who will agree or oblige to speak actually what you wanted to listen. So no, I went to the doctor. The doctor said I do not have a PCOS, and then this doctor would be like, it says up to you, who do you believe. These are all highly stressful conditions that forces a person to jump around places, not knowing who to talk. Not everybody can answer an infertility case, no? There should be a gynecologist, or she should be a practicing infertility specialist, or a person relevant to the field. So to classify whether this is the only reason why an infertility is occurring is more important. So stress mounts up among such in areas because most of your questions that's arising out of it is not answered, or you're struggling to see can answer. What would such condition lead to a person? You got depressed. There's lot of mental turmoil. I just don't know what to do. Too many questions clouded the mind. I'm unable to work. There is no focus. So what does the person do? I'm not listening anything, and then you mentally shut down. So the shutting down gradually would go like, I don't feel like eating. You don't get a sleep because every night there is this disturbing thought. What if you don't get pregnant? What would your mother say? What would your in-laws say? What would your sisters and siblings would say? What would your husband say? And then for all these questions, which actually has no answer, unless or until you vocalize out to say there are these questions, it lands up in depression. So what actually happens, the lack of interest in expressing gradually seeps in. So to eat, no, I don't feel like eating. Now to get up and go to work, I don't feel like doing. Now when you're working, I don't feel like focusing. And what happens, the chain reactions of not doing is all reflecting out of you, and there is no incurrence out of that. So that leads to a depression. So you would say, she did not talk to me, he did not talk to me, that person is not at all bothered. I find that the entire world is like all busy with their own accounts. Nobody is bothered about what I am undergoing. In times of their need, I was always there to help. All random, unnecessary thoughts that just run. It is too much of internal talks that makes a person completely shut down. So it is actually, the starting of a depression is like failure to recognize that you have not told what you are up to, what are your thoughts or feelings to at least an immediate person, for him to get back. Hello, what has happened today? What did the doctor say? And then when you talk, doctor told this, there is an interaction coming back. Oh, today is supposed to be an appointment. What did she say? Yes. Unless you're not going to open up to say, what is your current status? How would you get a reciprocative answer? So depression seeps in very easily among couples who are looking into this area, because this is a topic that's not much vocalized. You don't speak about it, and sometimes you brush it under the carpet like it doesn't exist. So it gradually comes in. So among these people, sleeping disorders are closely associated. You don't get a peaceful sleep. Your sleep is always disturbed. There are thoughts that creates fear, and then there are thoughts that creates so much of anxiousness that you just wake up and you just start preparing for the next day. Your body is not rested. Half the body is highly stressed because only one part of the body is continuing to do its work, not allowing the other part of the body to do the work. Sleep disorder has its own impact on physically, hormonally, as well as neurologically. So this is one of the way to see, did I sleep properly? What do you mean by sleeping properly? Was there an 8-hour sleeping duration minimum? Was it a peaceful sleep? Did you rest thoroughly? Were your body relaxed when you sleep? When you woke up, was there freshness? Was there a reviving thing? Did you have that zeal? Yes, this is a new day. I'm geared all to move forward. Or do you need an alarm? Do you need an external trigger to say, hey, you have an office, there is an important day, there is an auditing, there is this, there is that, and then you're motivated to go because of that. You need to look into it. Now, one leads to the other, right? What is the next one? The next one is a sleeping disorder, will be eating disorder. When you do not sleep properly, your body is not able to function properly. First sign or classical symptom is indigestion. Digestion causes a lot of disturbances in your bowel mechanisms. You won't feel like passing, or you won't feel like eating. There's too much of bloated and gassy sensations. So what happens? Either you pile up to eat when you're hungry, or completely deny eating. So leads to a lot of imbalances. That also puts on to weight management program, which is again starts going out of you. See, one inability has its chain reaction on other inabilities creeping in. Now, when you not eat properly, there's no proper nutrients in the blood. So how do you expect the internal organs to function? Right. So with the internal organs that needs to be function, nourishment plays an important role, for which you are supposed to eat quality food which is nourished enough. So these are all the most important factors that needs to be covered up among eating disordered people. Eat properly, eat thoroughly, eat a plate which is carrying a lot of nutrition rather than a plate that carries nothing beyond just empty carbohydrates and loads of fat. The next psychological state that one would be undergoing when the moment the person says and you hear this is anxiety. Okay, what if this happens, what if that happens? So there's a lot of questions that arises in the brain, and also equally we see the questions is not equally vocalized, they are just lost in the thought. And when we ask them, it is slightly difficult. Only when a psychologist finds that comfort zone where the patient feels like opening up and talking is where the anxious related questions are all coming out, and then gradually the anxiety is also reduced because she's already vocalized and questions are being answered. The most important psychological state that is very common among couple who's there is a condition for infertility is being now diagnosed, you need to go for the treatment. Immediately what happens, on an average among certain couples, the bondage of intimacy starts becoming thinner. Okay, tomorrow you need to visit a doctor. Okay, day after tomorrow is a scan. Oh, anyways, I'm taking an injection. Anyways, I'm taking a pill. I am monitoring through scan. This is going on, that is going on. So, couple has actually forgotten or lost the touch of actually what needs to be done. So, intimacy monitoring is also one of the important factors among treatment seeking couple to see how healthy your personal life is also. So these are some of the psychological states that would be exercised or validated among couple who finish a consultation and who's looking for a help or a support or a psychological pillar to rely on to say, let's say, ma'am, this is what doctor has told to be suggested. This is what she suggested. And this is what our plan is, but we do not know how to go about, where to conclude. Is it an ever-going plan, or is it being, modified, subjected, treated? This is where a counselor comes to offer great help, or even a care manager. So they would explain, this is the treatment advice. This treatment has a certain expectations. Based on the expectations, these are the things that you need to follow up, and there your stress reduces. The moment when the doctor says that let's start looking into the treatment, first question that would strike everybody's head is, why no pregnancy? Right? My hormonal blood test reports are normal, I have regular periods, my tubal health is also patent, my endometrium thickness is also good, but still no pregnancy. My semen analysis report is normal. My ejaculation health is also good. My intimacy life is also regular. Why am I not able to make my wife pregnant? So the question between the female the female remains to be the same. Why? No pregnancy. Why am I not achieving the motherhood? Why am I not achieving the fatherhood? So let's look into some, treatment based aspect. What would be some of the challenges that would come up? So on an average, you would start visiting your consultant, and then she would say, let's monitor your ovulation, and then the ovulatory modulation will go on to a insemination of washed prepped sperm into the uterus to speed the process of pregnancy. And then a pregnancy test is done after an interval, and this is a brief journey. This is the smallest part for the larger IVF treatment. Egg making is something that everybody would be focused into, where the doctor would either put you on a simple medication or an injection, basically stimulating the ovaries to start growing follicles. How they are growing, how naturally they are growing, the doctor would monitor on regular basis. So timely visit, your regular scans, your timely medications, already three things you are doing. So once your follicles start growing, initially you see a few, then gradually all will subside and one dominant follicle will start growing. From there, the doctor would monitor and probably put you to a medication. It says, see, the follicle is going to rupture. This is what is going to be a fertile window period. You need to be as intimate as possible, and then probably we can get back to you. This process has not worked out. So after the medication or the injection which says that that dominant follicle is going to rupture, doctor would suggest for an IUI treatment where the sperm is being collected, washed, and condensed it and inseminated into the uterine cavity. So this is what in brief an IVF in IVF, which is an IUI, is all about. Let's look into this laborious process of IVF. It is step by step. Now, every step is going to stretch, right? Visiting the consultant will have multiple visits. Then, documenting your follicular growth, there is multiple visits, but on regular basis, as well as see that the size, the endometrium thickness, and all comes to the documenting part. Three, once your blood work is also done to cross check whether the follicle that is growing is also very healthy, or what is the status of the growth, it can be cross checked. So this goes hand in hand. This is also stretched. So there's a lot of medications that is given which stimulates your ovaries. Initially it was by tablets or one or two or a few. Here in IVF it's going to be everyday medications which is through injections. Now, once the oocyte comes to a maturation stage, there's going to be an egg retrieval procedure. Now, in IUI, we did not do procedure, rather we inseminated the lead. But in IVF, the insemination is going to be outside in a lab. So in vitro, we are doing the fertilization aspect. So we are going to collect or harvest all those grown eggs. Okay. So the lady is subjected to a minute dose of anesthesia. She is admitted, and then while she is discharged on the same day. The collected eggs or the oocytes would undergo a denudation process to check how many eggs are good, what was the quality of eggs retrieved, and then quite a few answer gets addressed. Oh, out of let's say 20 follicles, only 15 eggs were good. What happens to the 5? So there could have been a chances that in the past, while ovulating, the eggs that developed wouldn't have been of a good quality. Anyways, there is no treatment for rectifying that, so we discard that. But something to bear in the mind that we have to keep all these factors, on the go to see that when you stimulate, you tend to grow good eggs. Now, once the egg has been denuded, fertilization happens where intracytoplasm or sperm is being injected and it is kept in a petri dish for 3 to 5 days for the embryos to grow. All these are part of fertilization. Anything can happen during the fertility period or the embryo growth period. As minimum as 3 days, say we start looking into the developmental aspect. Some embryos can get arrested and died. Some embryos might not multiply. Some embryos will just continue on growing. So all the embryos that continue to grow, they are graded. Otherwise, how do we know that who is very good and who is okay, right? So keeping aside all the embryos, and only two embryos that is decided to be transferred is kept for a blast culture, which is an important stage in the embryos, to say that implanting such embryos or transferring such embryos can result in a fruitful implantation. So the embryo transfer is done, after which the lady has to wait for 2 weeks, medication support is given, and then a pregnancy test is done. So the laborious stages of an IVF drags a person to say that every in every point of the IUI, it is simple, it's the same process. But if you look into IVF, it is stretched. So visiting the consultant, initially it was once, but now many times. Follicular development, initially it was 1 or 2 times, now it is becoming every alternative day. Medications or injections, ma'am give just a few and then one injection. Now it is everyday injection. Then procedure happening. Well, IUI finished in 5-10 minutes. We left home in half an hour. IVF takes time for discharge. Then, after the fertilization, there is something called transference of embryo, and post the transference of embryo only, one can expect a pregnancy. But in IUI, within 15 days, you can still do a blood test to check up whether you are pregnant or not. After which, of any of the treatment, the doctor would advise a rest, the doctor would advise minimum activities, and at the same time active activities. You need not be sitting all the time. So avoiding strenuous activities is the most important part of it. So this is what is the reiterated criteria here to say that. But when this is the the procedure that is being told, initially it is like yes, let's go about this, and we will do something more about it. Then suddenly, when the treatment starts, ma'am, tomorrow there is a puja, probably we might not come for an injection. Oh, that's a costly decision. Why? Your medications are on daily basis and mandatorily time based. They have to be taken every single time. This can be a challenge. There's festival round the corner, how to go about with the infertility treatment. There is a sudden guest who has dropped in the house, so we do not know what to do. There's another challenge. Or anything else that can come up. Irregular eating. I'm also working, so my eating habits is really gone for a big challenge. So I'm not able to eat on time and every time. So I have loaded my breakfast, I skipped the lunch, and I've loaded my dinner. Stomach wise, I'm full and happy. But you're taking medications on time every time on a timely basis. So they do interact. You need food. So these are all some of the psychological causes that you have to sit to really think and plan to say, okay, what am I going to do? I have to decide for my treatment because age is going. The duration after marriage, the trying duration is way beyond what is being recommended. We do not drink or we do not smoke, and even if at all there is any alcohol abuse, it has been stopped for over a year. My weight management is really very good, and the exercising is also really very balanced and normal. So once you get into the rhythm of this, it's high time that you also take up the treatment to see a fruitful outcome. So this is what is all about what an IVF can do, what an IUI can do, what a consultant would do for you by monitoring you for a natural cycle. So in natural cycle, our doctor would look into to say, I will monitor, medications are given, support mechanisms are told. You will be just monitored to check whether your ovulation has begun, ovulation has happened, follicle rupturing has taken place, and whether the intimacy has led to a pregnancy. All this will play a very important role. So this is how the journey goes. Understand where you stand in the journey. Are there any past history, medical history, or gynecological history, or an infertility history that says you need to look into this aspect also? then be cautious in following them. It's like your religious festival activity. 3 days, I'm not going to do anything. I am focusing on my prayers. So do your treatment. 15 days, I'm not adding anything. It is dedicated towards the treatment for the doctors. So I have to be there on time, which is very important. I have to be there every time when the consultant says I have to come and meet. My medications that is guided, instructed to be followed religiously every time and on time for follicular growths, which will be cross-checked with your blood test and to say that on an average things are going good. Completely understand what is the catered procedure given to you by the doctor. Is it going to be clubbing with two or three more procedures, or it is just going to be one single procedure? Remember properly when your doctor says when you need to take rest and when not to move, and always see that throughout the journey of pregnancy you avoid strenuous activities. So these are the handful pointers that you would take to avoid or reduce the challenges that you will be subjected during the procedure. So with this, I would like to ask the participants if there's any question, or do you face any challenges that you do not know why, or do you need anything that we would say that, can you ponder on a little bit? The session is also open for questions now. Any questions? Okay, so if there is no questions, it would be a request to all the people who are planning for pregnancy to, without fail, go to a proper counselor also. They will help you to cater based on your needs, your plans and needs. When will you need these counselings or counselors who will help you out? Either before or during or after your infertility or fertility investigation. Either before, during, or after a treatment is being advised. Irrespective of what the procedure outcome can be, get to know what is the actual procedure, what is the unexpected outcome, and you will also try to gauge what would be the outcome expected out of you. So it is ideally good that you do not involve anyone who is not involved with the treating doctor or with their couple problems, because there is a great tendency for, though the counseling would seem to look the same, but without the knowledge of the treating doctor, a counselor cannot say something out of the blue just because it is available in text. So there should be a hand to hand understanding with the treating doctor and the counselor, so that the counselor would properly explain or make the person understand what actually the treating doctor mentioned. So meeting the fertility counselor here becomes very important, because it serves as an opportunity to explore your thoughts. It serves as an opportunity, like what you are actually feeling when the treating consultant says about, okay, let's monitor, let's get investigated, your analysis report says that you have this as an ailment, this as an inability. What are your thoughts running behind them? What are your belief system when certain things as an ailment comes out, and how do you face or challenge it, and how is your relationship more important than others, but that to oneself? So these things a counselor would help you to understand where you actually stand. Your treatment is actually next. The counselor would also support on your day-to-day processes, why certain investigation is done, why certain things are ruled out, why certain things are told by the doctor, what is the importance out of it. They also help you to accommodate, doctor told me to do this, but I am just not feeling. So the counselor here would make you to understand the importance of procedure, at the same time addressing all your feelings. So this is a very important move that a psychologist would play among a treatment seeking couple. The doctor has called, but I just don't feel like doing it now. I can't tell the doctor, there's so much of stress out of this. And there the doctor says, excuse me, madam, relax. Where will the relaxation happen? When your mind is running. So the counselor here would suffice to help you to facilitating you getting relaxed. You should always understand that people who are doing, who are giving psychological support are people who usually do follow empathetic framework, are non-judgmental, and always we encourage the clients to find the solution. Never there is an imposition. The psychologist will try to explain you, this is the position, these are the venues to get the answer, and always will try to validate the answers that you want to do, whether they are right, will they lead to a fruitful action or not. So on this basis, um, please get in touch to wherever you're getting treatment. If you do not have any treatment seeking doctors, this the platform is always open for the couples at Apollo CM Fertility. We are located in JP Nagar 6th phase, so kindly walk in for a fruitful future. Thank you.